Hi, welcome back to Because Looking Good Feels Good with me, Dr. Janet Allenby. We had a little technical difficulty. I think the Wi-Fi is kind of messing up today. Maybe it's the storms down here in Florida. We are having such storms here. Anyway, again, back to work here. We are all following protocol and we want to make sure everybody stays safe. It's so important, and it is so nice to be back and seeing people and visiting with people and just hearing everybody's story. And I think the best thing I've heard is everybody's kind of like found an inner peace with themselves here. Of course there's a couple people that are probably just wanting to kill everybody, which is not a surprise, but I think a lot of people kind of found the time actually enjoyable, or maybe like something to help learn about themselves. So when I came back, I kind of was listening to patients and some of the staff, and one of the questions we keep hearing about, and it is something over and over we keep hearing about, is one, it's kind of like, why do we do things differently here in Allenby Dermatology? And I think one of the things that drives here is actually my own aging process. And one of the things probably about, I'd say about 6 to 8 years ago, I realized is really shape is where it's at. When we're talking about faces and attractiveness, shape is one of the biggest things that we can manipulate, more so than wrinkles, in how people perceive us and what our brains think is actually a beautiful or attractive. And so how do I augment that? How do I bring people to the best level that they can be? I have a lot of different tools in my pocket, but one of the things that I kind of do differently here, and I have been doing this for years, is, and I know people hear this a lot from me, is I use a ton of Sculptra. Sculptra is a product that grows collagen in. It tends to last about a year where I put it. Some people get longer, even up to 2 years with it. Some people are a little bit shorter, or they really might need more initially. But it's been one of the workhorses of my practice for the last probably about, I think it's been around 2004 is about when it came out. So that's how long it's been one of the workhorses. Anyway, but one of the things that I did is I use it differently than it was originally intended for, but that's kind of normal in our field, is we kind of take a product and we utilize it in a way that's going to be the best for the patient, the best outcome, and how can we really make this product work. So what I realized is that Sculptra, when it grows in, because what this means is I have to put it in just like an injectable filler, but when I put it in, it's fluid that people see, and they really like the look of the fluid. But that's really kind of fake, because it's just liquid that's going to go away. It's a bacteriostatic water and a little bit of lidocaine, and that's how we actually inject it. So what happens is the fluid goes away, but it's leaving the product, and the product is a natural sugar product that is very, very safe. I've actually never had anybody have a problem with Sculptra itself. And it creates collagen build, and so it actually grows collagen in. So I realized we can use it, we can use it to kind of pull out wrinkles, we can use it to kind of pull out acne scars, but more importantly, we can actually use it to kind of shape things, and shape is where it's all at. We look at things, shapes are what trigger our brains. We don't have time to look at fine-tuned things. We kind of take the idea of a shape, and that's how we utilize it to say this person is this age, this health. We can categorize people, and we can make decisions quickly that way. So one of the questions that I get a lot about is, how do I use Sculptra, and how do I use it differently than anybody else I know? Because I kind of followed my own path on this one, and I realized that using it further back in the face is probably key. Now, I do use it in the face itself, but one of the big things to start with, especially if somebody's new to this field, meaning they just started getting injections, one of the things that I can really change is sometimes the shape of the face. Now, Christina is my PA, and she's going to help me with our patient that you're going to meet today, because we are going to inject Sculptra the way I'm talking about. And what we did is that she came, we came back from the COVID incident, and she's like, I don't like something about my face. Something's going on. I'm not happy with it. What can I do to improve this? And she talked about this on her live Instagram too. So one of the things that I have been doing for years, so it's not like this is like, wow, we magically made this up. This has been going on in my practice for many years, is I use the tool of Sculptra in the scalp, not in the face. And I'm going to show you why, because I'm going to show you some skeleton pictures that helps you understand why I decided to start doing this. And when it grows in, it's going to change the shape of her face. Now, in her case, I use Sculptra in this part of the face because she's lost weight, and this area just kind of started looking too weak compared to here. And when you look at this picture, if you didn't see this picture next to it, you'd be like, what are you talking about? And just it's the years of experience and understanding the golden ratio and understanding what our brain finds attractive. I know that if I can make her a little more square looking, it's going to make this part of her face pop more and be much more the highlight of her face, instead of in this picture, and this is what she looks like naturally, is this area kind of looks like the highlight of her face. And when somebody sees her, they're going to look at this versus now when they're going to look at it, they're going to look up here. So that's kind of the rationale behind it, is how do I manipulate the shape to make the face more attractive, and what other tools do I use? Now, a lot of people hear about threads, so I do use Sculptra and Threads together because one, it helps the threads stay longer, but two, it's kind of a different tool that's going to give me something a little bit different. And in her case, we did Sculptra throughout the forehead, like in the hairline, in the scalp, and then I use the threads just to give a little more pop in the cheeks because it pulls up and it doesn't give more volume. Now, a lot of patients for many years, I use Sculptra in the scalp just like I would have here. Prior to threads, I would possibly, and she could support this too, but I would put Voluma or Wrestling Lift in the cheek to give more cheek shape. So it's about trying to make this the focal point of vision of other people to us or ourselves in the mirror, but more like how we are perceived, because we want this part of the face, because it's rare that this isn't the highlight. Like, people are usually most attractive in their eye area. And when sometimes their lips are very attractive, but it's a secondary. This is our personality right here. So when you can see this stronger, you end up saying, wow, this is like really pretty. She's beautiful here, but stunning in this one. And it's because of the augmentation of the middle to the upper face. Now I'm going to show you a picture of the skeleton. So one of my assistants is going to bring it a little bigger, please. Good. This is a picture, and you guys have seen this on one of my other live Instagrams. This is a young skeleton, older skeletons. Okay, obviously not the same person, but the shape can tell you a lot. The architecture of the structure is different when you're young versus when you're old, and it's the wear and tear of the face. And it's not a negative, it's just this is what happens. We have muscles that are pulling on the bone, and the bone actually absorbs and it reshapes. And that's what happens when you're a runner. That's what happens with your leg bones. You can make your bones stronger by running, lifting weights, because you're putting pressure on the tendon that is attaching to the muscle that is attaching to the bone. So the pulling actually changes the way the bone is shaped over time, because bone is also basically a living organ, and it's always changing also. In your mind, if you can look at this first picture, you'll see a shape that if you can imagine structures on top. And we do actually have some apps that are fantastic. If you ever want to come in here and look at them, you're welcome to. But actually, Galderma made a great, they have a great teaching tool that shows different layers of skin and fat and muscle and vessels and all this stuff. But you can layer them in and out. But when you layer everything on top of this, so even just put a sheet of skin on top of this versus on this, you realize that it's going to look different, and it's going to be, usually the big cues are the angle of the mandible, which is the mouth. It's very 45-degree angle here. It's kind of sharp. You would end up not seeing the neck because it's so sharp. There's a good delineation. You start losing the shape because we all talk and eat and talk and eat and talk and eat. So when you're pulling, you lose the shape of the mandible, and then you start seeing into the neck more. The more you see one length, the more it looks older. The more you see an angle shape instead of a square shape, the older our brain knows that's an older shape. The eyes are really cool. What happens is the eyes are kind of more forward when you're younger, and you can see the shape here, but believe it or not, the eyes of the muscle pull, because we're looking, and that's why the back of the head's so big back here, is it holds that big occipital area, which is our vision area. It pulls on the eye orbital bone, in the parameter of the bone here, and you can actually see some of the indents that it's changing, and it's kind of changing the shape of the eyes. So eyes when you're younger are shaped like little goggles, okay? When you're older, they kind of bloop, go into fish eyes. So you kind of go open, so you end up getting dark circles. You get dark circles. So if you put skin on top of this, you'd be missing this, and there'd be a hollow, so it'd catch a shadow, so it looks dark. And also the eyes kind of go down and out. So these are shape changes that are really obvious to our subconscious, and we can see those and go, oh, that person is this age. So even like you can tell when someone's super skinny, maybe something happened, they had a huge weight loss, I mean a severe one, but you can still tell by their skeleton. Even though you can tell they're sick, you can still tell they're young because it's the shape underneath that's doing that. You know, again, and I talk a lot about teeth. Teeth have got to be taken care of, and you have to make sure that your mouth is structurally good, because that's the whole support of this entire area. So when you don't have teeth, you're not putting pressure on the bone, and then it doesn't remodel and it just erodes and it's gone. So then you have this big empty space there. And I like a lot of analogies. One of the good ones with this one, if you've ever, like at Halloween, you can think of the, can you go hit that please? At Halloween, you see kind of that witch face, and it comes from like the apple face, you know, the little apple that kind of shrinks in the middle, but it's kind of like everything kind of dives in. The chin gets big, the middle where the mouth was, because there's no teeth, actually sink in, and there's no support for this area. Even this area starts eroding. You know, lovely, right? So you can almost see there's more projection in this part of the bone, which is here. And when we start losing some of this, and this is a big discussion in the office too, is when you start losing this shape, all of a sudden you get a lot of elongation to this area. So the skin is just the envelope on top of the structure. And what we're trying to do when we work in here is we're actually trying to manipulate the shape a little more, try to do it in a way that lasts a little bit longer for people, and still give a very elegant, natural appearance. So when I change the shape, you can't really tell the difference, but you can just tell that they look better. So when we see these shape changes, can you go to the next slide, please, for me, Jasmine? Yep. We have a lot of things going on right now. Okay. Catrice, and I'm showing people that work in my office because they don't mind that I show their pictures. Now you can tell from this one, you see a lot of real estate here. So there's a lot of view between, basically it almost starts from about here all the way down to here. So that length, oh, wow, we got a lot of phone issues out there. There's a lot of line here, so it's not crisp. It doesn't have the elegant look that she wants. So what we want to do is we want to do something that's going to give more strength out here, give her a little more cheek shape, and we'll put the focus back on her eyes. And you can see when I put Sculptra in the scalp, and I have been doing it again for years, and then I put a thread in her case. And not always, like sometimes I'll do Sculptra and I'll do a little voluma there. So I do the Sculptra and I do the threads. And the reason I use Sculptra is it's actually a really easy injection as far as people tolerate it well. It doesn't cause a lot of inflammation. Again, I said before, there's so rare to have anything negative. The worst that's probably going to happen is it's a little uncomfortable afterwards. Just poking around, you know, with anything, you might have a little bit more bleeding. The scalp is a little bit more vascular. Wow, we are really going crazy with these phones. And then the other thing that happens that is kind of normal, and I kind of use it as my barometer of when do we need to do this again, is sometimes you get bumps in the scalp. If you ever feel your own scalp, you will realize that the skin is very thin, meaning skin is right against bone. There's not a lot of fat and there's not a lot of muscle. And as you get older, that's even less. And if we went back to the skeletal pictures, you would actually see a bigger hollow going on here. There's a large muscle that attaches in here, and it actually pulls, and so it ends up causing bigger concavity back here in the scalp even. So you have it here in the temples, you know, because you kind of, I think a lot of people think, oh, if I just fill my temples, I'll look fine. Sometimes they're actually goofy because they overfill them. They look like, particularly for women, you don't want overfilled temples because you look too masculine. A fuller temple tends to go more masculine, especially if you're not filled behind there. So I tend to like to start further back and fill this entire area. And you can see just from these pictures how much more indent she has here versus this area is fuller. And when you look from this picture to this picture, there is a lot more, like you tend to want to look more here, you know, and that's what is the beauty of this is a little procedure up here actually equates to the entire face. You end up seeing less of this whole landscape here, and it actually kind of forces our eye to go right here, and you end up seeing this mid structure here more, which is where we want to focus the attention. Again, it's back to the eyes because the eyes are what win. Jasmine, can you go to the next picture for me, please? Thank you. Again, see how everything kind of looks like it's empty behind there? And now that I'm saying these things, your brain is seeing what I'm talking about because it's like, oh, I see. This is more hollow out here because we go empty here just like we go empty here. And to start here is kind of, and it's our fault. I mean, in the beginning we said, just fill up here, it looks good. And everybody did, and everybody kind of started looking weird, you know, and that's why I talk about these things on this program is it's really to give you guys better information so you can make better decisions. To fill in here would probably fix those, but she probably won't look better. And what you have to do is you need her eyes to be the focus again. So when you fill out here, where you can obviously tell, now that I've done this whole discussion, you can see how empty she is back here, making her broader here. So when I make her look a little broader or wider here, her face actually starts looking shorter. And it's just an optical illusion, and that's a lot of what we women do. That's why we wear makeup, that's why we do a lot of stuff. It's to kind of force the eye to a certain area or to highlight or de-emphasize certain things. So we want to emphasize her eyes because those are her pretty area, you know. So when we end up making this wider, it actually shortens the face up and it pushes our attention back to the eyes. You know, when you think of somebody older, you hear the word long face, and that's because there's no width anymore. We've lost a lot of the structure. It's kind of just gone with age, pulling, wear and tear, and people look longer. So younger people actually look either rounder, heart shaped, but they tend to have more of the emphasis in this part of the face and a little bit less here. But when you're older and you have no structure here, I might have missed saying this. Okay, when you don't have the structure up here, the skin is like a curtain. It's like a piece of fabric. It doesn't have support. Everything will hang below it. That's why this area becomes the focus of problems in people's lives. When people come in, the aged area usually shows up here, and it's usually in the somewhere late 40s to early 50s. People start walking in like, I don't like these jowls, I don't like these, I don't like my neck. And it's only because all of this is empty and then all of this is empty. If you just fill here, you're still missing half the boat. You have to start high and work your way low. It saves you, one, money, because you're not going to use as much product that way, and two, at the end of the day, it looks better. And that's the most important part, is it just looks cleaner and it looks more natural. People are like, wow, you just look like you got rest. And that's what she looks between here and here. Now, again, we did do a little thread on her too, just to pop her cheek. She's had a lot of filler in the past, and if we add more filler to her face, she might end up looking too big. So that's where we kind of gauge it. And it's just a different tool, the threads. So I think a lot of people are really excited about threads. They're wonderful, and I agree. They are just like amazing. I probably got a million on my face. However, they're not the only game that helps us get the look that we're trying to attain. You have to use different tools in our toolbox, and they're always coming out with new tools. I mean, I've had different companies on who are telling us that, you know, we have a longer lasting Botox coming. We have, you know, honestly, I just did the kiss on my lips. I love them. I think they look more natural. They look softer, but I still get the fullness. And, you know, so getting newer tools, new things to play with and see what works, what doesn't work. That's my job. But my job makeup translates to you guys looking better at the end of the day, and that's what we're all about. So today we're going to do a consult with a patient who's allowed us to show her on live Instagram, and we're going to talk about what her concerns are, what she doesn't like, maybe a little of her past history. And we're going to, I already saw her, so I know what we're doing. We're doing this. We're going to do some Sculptra, and we're going to do potentially a little bit of threads. I probably will, because I think it just is that little extra oomph. So normally if I'm going to do sculpting the scalp, I can do it by itself, or I would do Sculptra and either Voluma, or I would do Sculptra and Threads on people. So threads are not the only thing we would use, you know, and people are a little frightened of it. They shouldn't be, but they are. You know, it's a little bit foreign sounding to them. We're all used to filler. It's kind of a little bit more regular, but threads are becoming more so that. But I think that people have to realize we have some options, we have some choices, and we decide what's going to be the best for each person. So let's go ahead and go meet Lori, and we're going to go to the other room. So come on with me. Got all my masks, my mini masks up here. Jasmine was in charge of all my phone calling. So I'm going to yell because I have many masks on here. This is Lori. She's the only one who gets to wear no mask when we're close to her. Thank you for coming, Lori.
You're welcome.
Alrighty, so I have Christina, my PA here. You got to see her face, even though you don't get to see her face anymore, because she's all, you know, this is what we're wearing in the office because we have to. It's for your protection. Is it easy? No. I have terminal mask face now. It's not good. So thank you so much for coming. I gotta get some gloves on here. What we're gonna do is talk to Lori, and we were talking earlier, and tell me about what your concerns are.
I've had a lot of acne scarring that I've done Vivace with you guys and a lot of microneedling, and it's really helped a lot, but I feel like if it's filled in, it'll get rid of what's left on it. That bothers me.
Okay. So like you kind of, and tell us your age.
I am 39.
Okay. And so you basically had a little bit of filler. Have you had filler in the cheek at all?
In here, my lips, and I think she's put a little in here, but.
Okay. So this is actually quite normal to have somebody in her age group coming in, and this is usually the area that most people in her age group are gonna have filler. That's kind of the typical thing. Now we're gonna shift gears entirely, and her attractive level is actually going to go up quite a bit, and she's already beautiful. She is right. Now I will tell you, Sculptra can be used in the cheek itself to kind of pull out the acne scars. It would help. However, you're full. You have a lot of cheek on you, and if we put more volume here, you're gonna look kind of bloated.
Yeah, no, I don't want that.
Right. You want to look natural, and I know, you know, I've never heard anybody coming in like, I want to look unnatural. That just is not the game plan here. So we're going to put, now when I'm looking at Lori, and I got to see her earlier, so I know what's going on with her face. She has very typical, I'm in my later 30s, early 40s, in that game plan there, where this is actually getting too hollow out here, okay, out here. And actually she has a lot of bend in her forehead. And we want to kind of pull it out this way and kind of make her a little wider here, which will kind of help this look more lifted up. So we're gonna make her look thinner down here and here. One of the things that's really important about acne scars is people never lose the acne scar, and it's a hard pill to swallow, but what we do is we do as much as we can to mask them and to make other things look better so people don't feel that they're the focus of everybody else's attention. Because acne scars can be very devastating for people. It's one of the worst things. That's why acne treatment is so important. You have to do it, and you have to do it early, because you don't want scars. So you have to get on acne early. You know, for people who go, oh, it's just a cosmetic problem, I would slap them, you know, because that's mean. You know, when you have marks on your face, this is how we communicate, and that is just one of the worst things you can do to somebody. So, you know, acne scars have a lot of internal emotional significance. Acne does too, so you gotta treat it, and you gotta treat it early. So, I mean, I'm sure you dealt with that a lot. So
yes, I did.
Yeah, and it is. It's horrible to have. Now, we already cleaned up where I'm going to work on her. So what I want to do, might be easier to put her feet up too. Go ahead and turn that light on. Get her hair up. So when we do this, I I have to wear the mask here, so you guys, sorry, but it's gonna be a little more that I'm yelling at you guys. So sorry, but I want you to be able to hear this. I'm gonna go ahead and work in here. So her hair is already up, so I'm in pretty good shape right here. And a lot of our girls do have extensions, totally fine. We still can work in this area. Go ahead and get the light on here for me. Okay, we use the light a lot. This light shows me vessels, so I don't hit a vessel, and it makes it more comfortable, and it makes it a lot less messy when I'm working. Bring it a little closer right here. We're trying to stay out of your way to view this, and you're gonna see a little pinch here. Pinch, pinch, pinch. Here it goes. Ouch, 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 ouch. Ouch. And it's not that horrible. There you go. Okay, put those on there and put it on. Thanks. Okay, so what we're gonna do, so we made a little opening here, and that's where I'm starting for this. Sometimes I work from here too, so I can do both directions. And it's okay to make little openings. So I'm going right into our little opening that we already made. And it's gonna be a little uncomfortable through here. So this has a lidocaine, it has a little bit of water, and it has Sculptra. So you're seeing that it's kind of filling in this space. And I'm just getting a little here, just to have a better transition of her hairline, but I really want it more up here anyway. So I'm up here. You can see that hollow spot, and it's going right in there. How you feeling?
Good.
You're a good patient. Okay, switch the next one there for me, please. Okay.
You really don't feel anything. You hear it more than you
Yeah,
feel it.
do. It's like a squishing sound.
Yeah, it feels
It's
like, sounds like
very
water.
Exactly. So, like, even looking at her right now, she's already changing shape between, let me have the opener real quick. She's changing shape between this side to this side. See how it's already getting a little bit wider? There's like no bleeding. Everything is pretty simple so far. The worst it is a poke, and so far, probably the weird sound. Okay.
Yeah.
We're gonna go ahead and do the light right here. You gotta leave that light in because that thing goes up pretty quick. Christina does these too. She's helping me because everybody else left, and we're trying to keep staff down. There's a vessel there, so let me go above it. Ouchie, sorry. So she does these. So it's weirder when you're actually helping versus doing it when you're used to actually doing it. So she does all this stuff too. Actually, one of those pictures she did, the last one that we were showing you, that was her patient. So she does exactly the same thing. We have talked about it. I know this was something she didn't do in her last practice, and she's like, I've never even heard anybody doing this. And it really is something that is, a lot of people don't know that you can do it. They're kind of afraid to do stuff like this, but you know, being in this practice so many years and doing it so many years, I'm very comfortable with it. And teaching her the technique was easy, because she already knows how to do all this stuff anyway, basically. So I'm just kind of layering it in here, and the amount of volume that we're putting in this is actually 9 cc's of fluid, and it's mostly bacteriostatic water. There's maybe a drop of blood here. Teeny, 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 teeny. Nothing significant. How you feeling?
Good.
All right, anything outrageous here?
No.
Okay. You can hear she's obviously not in pain and quite comfortable here. All right, here. And I'm gonna make one more opening.
Which does not hurt, by the way.
It doesn't? You're
No.
a tough one.
It's really not.
Okay. All right. And I actually want to get across here on her. So you can kind of see this like kind of angle is too sharp here, so I want it right up here. This one might be a little stinker, okay? Here it goes. Ow, ow, ow. Go ahead. Thank you. And here you go. That one made your toes curl a little more. She's like, I'm fine. Lori is definitely fine. So what she's doing is she's just changing it. These cannulas, one of the problems with a lot of people with Sculptra is that the needles, this is not a needle, this is called a cannula. So one, it's not sharp, it's not cutting through the skin, it's a lot less traumatic. This says always a tighter area here, so it kind of hurts as I go in here. So I'm about right here with my tip. I'm creating a little more lift to the forehead. There we go, good, good, good. This is definitely one of my favorite products. So
I kind of want to stay a little, I want to not go as much into the forehead as I can, but I do need just a drop because she just has that too much bend in the forehead there. There we go. Pull it out a little. Just kind of manipulate it. So afterwards, with Sculptra, if I were doing the face, I'd have her massage for a couple days. You can massage the scalp, it's a little bit more difficult, and you will get bumps in the head. We already talked about it with Lori, so she knows that's a potential. Let me have my opener, and I don't need a light for this one. This is looking really beautiful. Go in the front and look at it. Alright, I'm gonna pop through here. The silver alone makes such a difference, and I'm gonna have you grab the mirror for her. So I'm just going from the back side on her just a little, because I do want to get a thread in her. It'll lift some of this and help some of the weight in your face. Hold on 1 second on that one.
1 minute. Sure.
It's harder being the nurse than the doctor, huh? It's like, I know, I helped somebody with one time and it was just kind of like, oh, what the heck am I getting here? Okay, so I am just kind of going in this direction because it's going to pad the area where I do want to get the thread in later. So I'm actually all the way down here and I'm just making a little better transition. So the whole thing with this is you can't, to really make these changes, it's not the threads alone, it's the Sculptra thread combo that really makes a difference. One, it's the Sculptra shaping more, and it's also the ability to hold the threads in place longer, which the Sculptra will do. Now, did you show her yet? Okay, let me show you this side. This is just Sculptra alone. Look at that side, look at the face, and I really don't want people looking where I inject it, I want them looking at their face.
Yeah.
Do you see the change?
Right here, it's a little up.
Yeah, it's like even this got thinner looking.
Oh yeah,
Everything,
completely.
oh, yeah.
This is like hanging right here, and this is not.
Right. You're not really hanging, but
Well,
yeah.
that's what it looks like.
Like everything kind of.
But I have a round face, so.
But it also, on her, also pretty eyes. I said this is the area that we need to really focus is make this the big piece. Like before, you kind of narrowed in on her cheeks, which pushed us to her acne scars, which she doesn't want us to go there anyway. So then on top of it, having this area wider makes us look up here more instead of down here. Okay. Grab the. Yeah. We don't want to ever drop a mirror. I'm very superstitious on that one. And if we did it on here. So what I'm going to do now is I'm putting the thread in. So I get my little opening. Okay. Do you have more gauze over there? I may have to make my opening a little stronger here. Let me see if I can even find my opening. I think it's right here. There we go. Okay, it's a little stinker sometimes, and I almost had it. Taking a second longer than I normally do just because we have a camera on here and everything else. So what I'm doing is you can kind of see it burrowing under the tissue, and I'm just twisting it into place so it snags the tissue. And I'm pulling this out and I'm just kind of pushing up the area as I work behind it. That's it. So this is a thread. And I would either do thread or voluma or something in the cheek. Wrestling lift. The problem is that she's full, and if I actually add a lot more filler on her, she's going to look too big. And I need one more thread, please. Okay. And here we go. We're going to do the other thread. And we have the next side about ready?
Yes.
Okay. So I'm going to the exact same opening. And going in, maybe. Are you okay?
Yeah.
Okay. There we go. So it's into about here. See if I can get a little further. There we go. I'm sorry, another little
okay.
touch.
She
is like
just feels weird.
You know, for her to be laughing, this is like pretty impressive. It's me. I don't think I'm a little more pain intolerant. I have to say, I'm still willing to do absolutely everything, but I definitely don't like the pain. So this is basically one side with Sculptra and Threads. And Carlos, where are we at time-wise? On the top there.
Well, it's 6:25 now. But
Okay, so, okay. And I'm gonna show you the before and the after. And then we're gonna do the other side after. Okay. So, mirror for her, please. It is, it's like,
It's just a little sore like right here, but it's not like.
exactly, and there will be some soreness. Okay, look at your face from this side to that side. Exactly.
Yeah, even this like doesn't really,
oh, nice.
like, yeah, it looks good.
Wow, 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 wow. So everything got lifted.
Mm-hmm.
The eyes become the focus again.
Oh yeah.
And I'm gonna have you drop it for 1 second. Look, see how everything on this side is stronger and everything on this side isn't. So I'm gonna work on the other side, actually Christina and I are, and we're gonna go ahead and sign off because I don't wanna keep you guys too long. I know you got a lot of good things to do out there. So we're gonna work on the other side, but this is the before, this is the after. Thanks for joining us. See you later. Bye-bye.